Good morning, everybody, or good evening, good afternoon, wherever you are in the world joining us today. Thank you so much for attending. As John says, my name is Sephora. I am the head of the medicine preparation program here at Abbey College in Cambridge. I shall be going through how we support students through medical school applications, and I will also be talking about what the UK requirements are for making a medical school application. There's a lot of steps along the way, and it can be a little bit sometimes confusing or a little bit too much to remember for students, parents, and agents. So don't worry too much if you can't remember everything or if you don't understand something, just ask us. I also noticed that you sent through a lot of good questions before the webinar. I'm hoping actually that my presentation answers a lot of your questions, but if you feel that your question still hasn't been answered, please do not hesitate to put some questions into the chat box. And as John said, I might answer them through the presentation if it's appropriate, or if I feel like it might not be appropriate at that point in time in the presentation, we will get to it at the end. But please rest assured that your questions will be answered today. So just a little bit about the medicine preparation program here at Abbey College in Cambridge. It is a highly successful program. We are very, very proud to say that many students every year receive offers from medical schools, which is not a common thing, actually. It's really hard for students to be made an offer from a medical school. So we are very proud of our track record here. And in the current year, so that's for September 2024 entry, I'm absolutely delighted to say that 10 of our students between them have received 24 offers to study medicine at university. So we're having a particularly successful year this year. And the reason why Abbey College sees such high success, with a high number of offers across our students, is because we have developed a supportive program called the Medicine Preparation Program. So we have a dedicated team of staff, which I lead, and together we support the students with every single step of the 2-year journey that they need to make that medicine application and get to the offer stage. So our medicine preparation program is built on 2 things. One of those things is adequate preparation. So we have lots of extra lessons, which I'll tell you all about, and lots of support. But the other really, really important thing is personalization. So the advice that every single student gets is different, because all students are different, obviously, but not only that, students come to us from different academic backgrounds. And so the advice that I give to one student is going to be different to the advice that I give to other students. So the personalization bit means that we correctly match students to universities based on their educational background and their educational performance. So I'm going to tell you all about that today. So I'm just going to start sharing my presentation now. And as John says, this is being recorded, so hopefully you can then refer back to anything that I discussed today when the recording is sent to you. All right, so let's start. So introducing the medicine preparation program at Abbey College in Cambridge. So as I've said, we've designed an in-depth program. This is for students that we call prospective medics. So a prospective medic is somebody who is planning to make a medical school application. It's led by me, but I'm not the only person in the team. We have a dedicated team of staff that helps students in different ways. And this is why we have a high success rate of students being offered places on medical courses. And so, as I've mentioned already, we had 10 applicants to medical school this year, and between them, they've been offered 24 places because students receive more than one offers from different medical schools sometimes. Okay, but before I talk about the medicine preparation program, I'm just going to hopefully be dispelling any confusion about what is a medic, okay? Because sometimes students get the word medic confused with scientist. So I just need to be very, very clear that a medic and this program is specifically designed for a student who wants to apply to study only one of these very, very specific courses at university. Medicine. So medicine means that they are going to be a doctor, a human doctor that will treat the patient directly with their medical conditions. So not a scientist, but a doctor that actually works with ill patients. So sometimes students join the program and then they realize that actually it's not for them because what they want to be is a scientist. So just be clear on your mind the difference between a doctor and a scientist. Also, a medic is a dentist. So obviously, this is a medical professional who deals with the mouth, so teeth, gums, and the mouth more generally. And then doctor of animals, so veterinary medicine. So again, that's very specific. It's a doctor of animals, treats their diseases. It's not for people that want to work on behavior with animals. That's something quite different. Okay, so generally, it's a doctor type profession that we prepare. The medicine preparation program is not for other healthcare professions. So it's not for pharmacists or nurses or radiographers or anything like that. It's very, very specific to doctors. However, that's not to say we don't support other students at Abbey College. Students who wish to study other healthcare professions or sciences, they are supported via a different program outside the one I run. That's via the pre-degree diploma. In fact, all students at Abbey College, doesn't matter if they want to be an engineer, a lawyer, an accountant, an economist, a physicist, all students are supported via the pre-degree diploma. So everybody gets specialist help. My job specifically is to assist students to become doctors, dentists, or vets, because out of all the professions, these are the most challenging to get into at university. But not only that, they are also the professions that require students to meet a number of criteria and have to complete a number of activities before making the application. So that's what I'm going to explain to you today. So as I understand it, a lot of you have either already signed up to join us at Abbey College today in September. Now, but before I go on to that, I'm going to give you 20 seconds to answer the medicine webinar poll. So there's a poll that's just flashed up on your screen. Which professions is the medicine preparation program designed for? So I can see lots and lots of answers coming up on the screen. I'm just going to give you a few more seconds before I continue. See lots of good answers. Some people changing their mind, which is good. They're really thinking about their answers there. Okay, I'm going to give you 10 more seconds and then I'm going to start talking again. All right, I'm now going to continue with the presentation. So As I understand it, some of you have already enrolled at Abbey College in Cambridge, and some of you are almost about to do that. So looking forward to teaching you in September. So when you're making your subject choices, it's really, really important that you have chosen chemistry, because all medical schools require this subject. You should also choose biology. Most medical schools will require this subject, almost all of them. Not every single one, but almost all of them. However, biology is really, really important to understand, because if you don't study it at A level, it's actually quite hard to understand at university. And they're a third math subject, a third science subject. So almost all students who will be making medical school applications will have maths. So that's why at Abbey College, we strongly recommend that your third subject is maths in order to make your medical school application competitive. Now, they are the three main subjects that medical schools will look for. However, when you join Abbey College in September, Year 12 students will start on 4 subjects, and later in January, you will be asked to drop one, because we always start students on 4 subjects just so that they can check that they have picked their favorite subjects, and then in January they will need to drop one. But if by January of the following year you still want to be a doctor, the 3 subjects that you should continue to study are chemistry, biology, and maths. All right, so besides studying those 3 A levels, the other university prerequisite that you need is you need to have taken the University Clinical Aptitude Test, more commonly known as the UCATs. So that will be taken in the July to September before the October applications are made. And it's only valid for 1 application cycle. So if you're applying to medical school for September of 2026, you would have to take your UCAT between July and September of 2026. Now, this is the most important test. So when you're making your application, obviously we will submit predicted grades for your A levels, but the university, the first thing that they will check is the result of the UCATs. And the higher you score on the UCAT, the more likely that it is that the university will invite you to an interview. The other things that universities will want to see is that you have an understanding of the medical profession. We call this clinical shadowing. So clinical shadowing is essential. This means you will have followed a doctor, a dentist, or a vet, watching them do the job. So this often will happen in a hospital or a clinic or a surgery, a veterinary surgery, a dental practice. So this is where the student observes a doctor, a dentist, or a vet doing their job to understand what the job is about. Sometimes we call this work experience, but actually the more accurate term is clinical shadowing, because you're not actually working, you're actually shadowing, you're watching. So when I say clinical shadowing, it means watching the doctor or the dentist or a vet. So just be clear on that. The other thing that students need to do besides watching a doctor, they need to do separate to that, is 6 months of volunteer work in a healthcare setting. And we help students to find both of these opportunities in the UK. So volunteer work, that is where the student themselves is doing the work. And that would be working perhaps with elderly people in the UK. Elderly people tend to live in places called care homes. Other places where you could do volunteer work could be in a hospital on what we call the wards. We also have places called hospices in the UK. These are sad places because these are places where people have terminal illnesses and they will spend the rest of their life there. So students will go and volunteer in those kinds of places as well. So you have to volunteer in a healthcare setting. For vets, you might volunteer in a zoo, for example. So all of these three things are essential prerequisites that universities will want to see that you have done. Now, sometimes students say, I've done clinical shadowing in my home country, or I've done some volunteer work in my home country. Is that good enough? And I say, absolutely, it is good enough. You should definitely be doing work experience in your home country or volunteer work in your home country if you can get it, because actually universities like to see that international students are able to compare the National Health Service in the UK and make comparisons to the health service in the home country. In fact, it makes your application stronger having observed different types of healthcare services and being able to compare. So please, absolutely, if you can get some work experience or clinical shadowing in your home country this summer, please do it. And I cannot wait to hear all about your experiences. So if you are able to join us as a Year 12 student, this is what we call the first year of A-levels. That's year 1 of A-levels. Now, to qualify for year 1 of A-levels, which will enable you to have the ability to make a competitive medical school application, really, you should have already studied GCSEs. So that's the qualification that students study in the UK before A-levels. And this is because the other students that are making a medical school application, they will all have studied GCSEs. And the more GCSEs that you study, the better. So we recommend that you study at least 6 or 7 GCSEs. I put that there as a minimum, because truthfully, the other students who are also making medical school applications, some of them might have studied 10 different GCSE subjects. And it depends on which GCSE system you study, but essentially across all your subjects, you really should be achieving level 8s or 9s or grades A or A star, including in the sciences and in the maths. But please don't worry, if you haven't studied GCSEs, home country equivalents to GCSEs is also looked at by universities. So generally what that will mean, and this is what often causes confusion, it really does depend on which country you're from, but generally this will mean having completed your home country high school certificate. So we have a lot of students that join us from say Iran. So for Iranian students, that will mean they have completed year 12 in their home country. So if you've only studied up to year 10 in your home country, it's better that you come to Abbey College and rather than joining us on year 12, that you actually study our 1-year GCSE program so that you can build up those GCSE qualifications. But that's just one example that I've given. Really, you are all from different educational settings. So if you are unsure as to whether or not you meet the requirements, it's best that you speak to us. It's best that you send us your current qualifications for us to have a look at so that we can advise you more closely. So if you do not have the necessary qualifications right now to study year 12, and there's a poll question that's just flashed up on the screen, so I'm probably going to answer this in just a second. If a student does not yet have the qualifications to start year 12, at Abbey College, we offer a 2-year GCSE program, so you can study year 10 and year 11 with us, and a 1-year accelerated GCSE program, perhaps if you're slightly older. The option which is best for an individual will depend on your age and to what year you have studied in your home country. So now I'm going to stop talking for a second and I'm going to let you answer the second poll question. All right, 10 more seconds for that, and then we'll move on. All right, so I'm now going to talk about what we offer at Abbey College. The Abbey College pathways to medical school from year 12. So as international students, you are fortunate in what is available to you to have a slightly easier pathway than perhaps British students to medical school. As international students, there are more options available to you. So this flow diagram is on the website, which you can take a look at it later. But if we just have a look at the box at the top, in year 1, you will start with us in September in year 1. You will follow the year 12 AS curriculum. Now, at the end of year 12, you'll have exams. And generally, in order to progress onto year 2 of A level, ideally, you will have achieved A grades at the end of AS, maybe 1B grade, in order to be able to access the year 2 A level course and still be able to make a medical school application. There are some students that perhaps don't do as well as they would hope in year 12, but their dream of becoming a doctor doesn't have to end, because thankfully at Abbey College we run an excellent alternative program to A level called the International Foundation Program. So generally students that don't do very well in year 12 on the AS program, it's generally because the exam style doesn't suit them. So that's why we have designed an alternative program called the International Foundation Program, that whilst what you learn will be the same as what's on A level, the exam is better suited to our students. Now, if you want to be a doctor, a dentist, or a vet, you can do that through A level. The International Foundation Program only is for those students that want to become a doctor, because the dental schools and the veterinary medicine schools only accept A level rather than IFP. So I can talk you through those routes when you start at Abbey College. So how are applications made to UK medical schools? So this is not just an Abbey College thing. This is what everybody studying in the UK has to do. They make applications to university via a digital service called the Universities and Colleges Admission Service, also known as UCAS. And there's the website there for UCAS. So through UCAS, if you want to become a doctor, a dentist, or a vet, you would apply to 4 UK medical schools. So you can apply to 5 courses through UCAS, but because it's so hard to get into medical school, you're only allowed to make 4 medical school choices, because in reality, a lot of students may actually be rejected from all 4 of those applications. That can happen. So we ask students to put down a safety option, which is not a medical course, but it's a biomedical science course, is the 5th option. And that's there as a safety option. So students could study that course, and once they've graduated from that course, they could apply to medicine as a graduate entry. So that's the just in case option. So we have to apply through UCAS at the start of the 2nd year of A-level, or at the start of IFP, and this will be by October the 15th for the September 2025 entry. That will probably be similar for the September 26 entry, around October 15th. So hopefully you will have demonstrated good grades at the end of year 12 that will allow us to predict you high A2 scores. Hopefully we'll be able to predict you at least 3 A grades, preferably A-star grades. And we also submit your personal statement and a teacher reference. We support you with the personal statement. It doesn't have to be by October 15th, but before you start the medical course, you will need to have met a minimum English language requirements. So medical schools will ask for a GCSE grade requirement, but we understand that most of our students at Abbey College are international students, and they do not actually have the minimum GCSE grade requirement. So this is why almost all of our students will take the IELTS exam. And so the minimum requirement is that students will have achieved 7.5 overall on their IELTS, with no lower than 7 in any component. Okay, so we've got a 3rd poll now. So I'll let you think about and answer your, submit your answers to the questions of this poll, and then I'll start talking again. Lots of good answers. Just waiting on another 4 people to submit their answers, and then I'll move on in 10 seconds. All right, I'm going to move on now. Now, as international students, you actually have a few more application options than the British students do. So besides applying through the UCAS system, where you apply to 4 universities at once, we have what's also called the direct applications route as well, which I ask all students to do as well. And this is to apply directly to some universities. But this is only available in the UK to international students. So here are some universities that you can look up that offer this direct application route. So we've got Brunel University, we've got Buckingham School of Medicine, we've got UCLan students, and Queen Mary Malta. So Queen Mary Malta is the same university as Queen Mary London, but rather than that campus being in the UK, it's on the island of Malta in the Mediterranean in Europe. There are other options that are outside the UK as well for the direct entry applications. So we've got St. George's University in Grenada, also known as SGU. That's an American system university. But you can actually complete part of that course in the UK campus, but it is technically a Caribbean university that follows the American system. Similarly, we have the University of Antigua. In Ireland, there is the Royal College of Surgeons in Ireland, to which you can apply directly. On the island of Cyprus, again, in Europe, we've got the Nicosia Medical School. We also have another sort of organisation called the Irish Universities and Medical School Consortium, also known as IUMC. And with this one, international students can make one application through IUMC, and it can be sent to up to 4 universities in Ireland. And so they would be Trinity College Dublin, Galway, University College in Cork as well. And but that's not open to all countries. So it will depend on which country you are from as to which of those 4 universities you are eligible to apply for. If you are a UK or an EU student, you can also apply to Ireland, but not through IUMC. You can apply through their Central Applications Office, which is a little bit similar to our UCAS system here in the UK. Okay, so besides making an application, before you get to the point where you make an application, you have to do clinical shadowing. So we can help you to get some clinical shadowing here in the UK. As I've said, we can help you apply to the local hospitals. So we will show you how to download the form. This is not something that you should be doing now. You should only do this once you have joined us at Abbey College, because I will need to write a reference for you to send to the hospital. So I can't do that before you've joined us. And plus, you need to be referred to the hospitals by us. So please don't do this independently. So when you join us in September, I'll show you how to download the application form. And then I need to guide you on how to answer the questions, because sometimes the questions can be a little bit confusing for our students. So I can help you with those answers. But if you're interested to know which hospitals are close by, we've got Adam Brooks Hospital, which is a very, very short walk down the road from Abbey College. So we're very lucky to have that hospital nearby. We've got a good relationship with them. There's the website there, so you can look up what work experiences that they offer. Also nearby, but this is a train ride away, we have West Suffolk Hospital. Again, we have a really good relationship with them, and absolutely you must not fill in the application form for this one without our help, because they are very, very particular about what you need to include. And we've also got the North West Anglia Hospital as well. In addition to that, we also encourage students to try to apply to general practice. You might call them clinics or community surgeries in your home countries. This is a little bit harder to get those work experiences, but if you can, that would be good. If you want to apply for dentistry or vets, you would need to apply to dental clinics and veterinary clinics. All right, now it's time for the fourth poll question. So I will keep quiet and then move on. All right, 10 more seconds and then I'll move on. The other thing that we will ask students to do when they join our medicine preparation program is we do online relevant experiences as well, because universities do recognize that sometimes, depending on where you're living or studying, it can be hard to attain clinical shadowing opportunities. That can be very challenging. So, but you still have to learn about the medical profession. So there are online courses that we ask you to do. So we ask you to complete something called the online GP, Observe GP online course. So it's like observing a GP surgery via the internet. It's a really good course. You really do feel like it's a real life experience. And we have the Brighton and Sussex Medical School online work experience as well. Again, that takes you through 6 different types of healthcare departments. For dentists, there's a few Future Learn courses that we ask you to do, Discover Dentistry. Same with the vets, some Future Learn courses that we recommend. The other thing that we do in your first term of term 1 is that we invest in you. We pay for you, no extra cost to the student or the family, to go on the Invest in online Young Doctor, Young Dentist or Young Vets weekend programs. They call it a weekend program. It's actually a one-day comprehensive program on a Sunday. Again, that's really useful because lots of fun activities to discover about the application process, as well as learning a little bit about the profession. You also have to do 6 months of volunteer work. Now, ideally, you will volunteer in a healthcare setting. So care homes, nursing homes, ward volunteers are the best ones, but there are age limits for care homes and nursing homes. We are so lucky that Adam Brooks Hospital offers the young persons program, 16 to 18. There's a link to the website there if you wanted to find out a little bit more about it. So lots of our year 12 students were and still are ward volunteers working with patients at the hospital. For vets, we've got the Shepworth Wildlife Park for Vets as an example. If you want to be a dentist, really the volunteer work that you can do is the same as doctors. There really isn't a specialty thing that you can do to volunteer for future dentists. So again, future dentists often will volunteer in nursing homes as well, which is okay because it's a healthcare setting and dental schools highly value those kinds of volunteer work experiences too. And here are some examples of charities that we have in the UK. We've got the Arthur Rank Hospice. We've got some students that are volunteers in the wards at the Arthur Rank. We've got the Age Hospice as well for you to look up. What about if you're really young, if you're 16 years or under, but you're really keen to volunteer? What you can do is you could do an online volunteer work program via the Medic portal. And then when you're old enough, you can then volunteer in real life in a care home or a nursing home. Although not a healthcare setting, we also send our younger students to go and volunteer in something called a charity shop, which is useful because they learn to build their confidence in communication and working with the public and organisation. So there is really something for everybody. How do we support students to study for the UCAT? Well, first of all, we add additional lessons to your timetable to rehearse the UCAT. But we also pay for you to have some training for the UCAT. So again, we invest in our students. We use the Medic portal for their UCAT program, which is highly successful. And what we pay for is a one-day live course by a UCAT expert. On top of that, we pay for 5 private tuition sessions with one of the Medic portal tutors. You are also provided with an online course and an online question bank with thousands and thousands of questions that you can use to help you prepare for the UCAT. So there is a lot of professional help that we give to try and encourage you to get the best mark on that UCAT. Something you could be doing now is doing lots of reading. Medical schools like to see that you know a lot about the profession, and something that they like you to talk about often is a book that you have read or several books that you have read. So here are some examples of books that you can read. Obviously, it's not limited to this. You might find others that you're interested in. Okay. So when you join us at Abbey College, what does the 2-year medicine preparation program actually look like? What is the journey that you follow? So I've got a little timeline here. So in year 12, that's term 1, year 1. So that will be from September to December of year 1. You will meet with me. I'll check the qualifications, make sure that medicine is suitable for you so that you've got your GCSEs or equivalent. And once I'm satisfied that the medicine preparation program is correct for you, I'll do that pretty quickly. Pretty much the first few days that you're here, you'll meet me and we'll decide whether you can go on the medicine preparation program. Once you're on that program, you will be completing online relevant experience courses. So you'll do your Observe GP, BSMS. Immediately we start applying for those clinical shadowing places at the hospitals and at the GP, dental and vet surgeries. And I also encourage you to start applying for volunteer work as well. At the end of term 1, we have a look at your grades. That'll be in December. If your grades are good enough, say you've got 3 B grades, we wouldn't expect 3 A grades in December, but at least 3 B grades really, then you can continue to remain on the medicine preparation program in terms 2 and 3 of year 12. And that's where the program really steps up, and we'll really start preparing you with lots and lots of additional information. So you'll learn about the NHS and scientific topics that you wouldn't normally study in your subjects. We teach you about medical ethics, university course options. We get you to engage in lots and lots of scientific research. So you'll do essay writing, book reviews, disease presentations. We will rehearse university interview questions with you. Towards the end of term 3, we'll start writing your personal statement. Hopefully you will have some clinical shadowing and volunteer work to do at that point. And at that point, I will really start preparing and planning with you your personalized routes for application to medical schools. So we'll look at your grades, your educational background, and we'll really start to put a pathway that's going to help you achieve the most successful route to medical school. And we also start applying through UCAS by creating a UCAS account. Also in terms 2 and 3, I haven't written that there. That's also when you'll do your UCAT courses as well. So in year 13, in term 1, you will take the UCAT exam. You'll do that by the September. So by the start of year 13, you'll have taken the UCAT exam. So you do that usually during the summer holidays between July to September. And in year 13, it's all about the university interview rehearsal. And then the UCAS application is finalized. So last year in 2023, that was October 16th. This year, it's going to be October 15th. For when it's time for you to make your application, it will be around that date as well. So it's always around the middle of October. So that's through UCAS. We'll also start applying to some of the universities outside of UCAS as well after the October 15th, 16th deadline. And for those students that are lucky enough to have been invited already to a medical school interview, we might even start the personalised one-to-one mock interviews for those students. But then after term 1, in terms 2 and 3, for the year 13 students, it's really the students are waiting for the universities to invite them to interviews. We might still make 1 or 2 more direct entry applications to medical schools, but really the rest of year 13, the rest of terms 2 and 3, you really should be studying your subjects. And what we do with you is just have one-to-one mock interviews with myself or somebody else on the medicine team. So obviously 2 years is a long journey. So you need to start taking small steps now. So what can you be doing now over the summer holidays? What can you do before joining Abbey College to start your medicine application preparation journey? So this is time to really enjoy, actually. So enjoy learning as much about the medical profession as possible. Read some books over the summer break. You could try and read some scientific articles and medical journal articles. You need to be aware of medicine and science in the news because there's always things changing in medicine and science. If you can get it, try and attain some clinical shadowing in a medical setting in your home country. If you want to do some online courses, you can just find out as much about the medical profession as possible. I'm not saying you have to do every single one of these things, because obviously it's quite a long list there, but here are some ideas of how you can find out about the medical profession. If you are old enough and if you're able to do volunteer work in your home country, do it. That would be great. Try and volunteer in a healthcare setting. But if you can't, don't worry. There will be time for you to do that when you arrive. YouTube is a really easy place. If you can get YouTube in your home country, you can watch video clips about university interview questions. There's so much information on there. You can also go on the website called the Medic Portal to start shortlisting realistic course choices using the comparison tool that they have. So there's a link to that. And this is really the time to self-reflect, really try to understand yourself and ask yourself one of the most important questions you could ask yourself. Is applying to study medicine really the right thing for me? Because often students will think that they want to apply to medical school and they start researching what the medical profession is really about, and they decide it doesn't really suit their personality, and that's absolutely fine. And you can start thinking about what you might want to do instead. All right, there is a poll question number 5. So, how does Abbey College Cambridge help students prepare their medical school application? Let's wait for a few more answers, 10 more seconds, and then we'll go to the concluding slides. So, what do you need to bring with you in September to ensure a nice, easy, successful start to the medicine preparation program? Don't need to bring too many things. It is absolutely essential, because this will be the first question I ask you is, what are your GCSE results, or what are your home country equivalent results? So bring your transcript of results. So it's your result transcript. It's also helpful to have the certificate as well, because you will need the certificate later on in the application. But at the very least for September, I will need the transcript of results. The other thing that would be really helpful to have now is your vaccination records, because when you apply to hospital work experience, they will need to see that you are vaccinated. So whatever vaccination records you can get from your parents or from your family doctor, please bring that document, because often that will, not having that vaccination records does create some delays in you being able to do clinical shadowing. What's desirable but not essential is that if you've got any evidence of any home country clinical shadowing or volunteer work, do bring that. It's not essential, but it would be good to have evidence of that. So sometimes you might shadow a doctor in your home country at a hospital, and they might write just a very short letter to confirm when you did that work experience and the dates that you did it. And also your own notes. It's really important if you do clinical shadowing and volunteer work that you make notes about what you have learnt from those experiences. Not just what you did, it's what you learnt from those experiences. To find out more about the medicine preparation program at Abbey College, you will find us on the Abbey College Cambridge website under what we call Elite University Preparation. So there's the arrow there to show you where we are on the drop-down menu on the website. All right, now we're coming to the question section. I think there might be some questions that have popped up in the chat. That's something that John has put in chat.
Hello, Sephora. Thank you. Yeah, you noticed that was me just putting notes in there. Thank you very much for that. Please do post any questions now. We do have a few minutes. So if you do have any questions that have come off the back of that, appreciate, obviously there was a lot of information delivered there, and hopefully you get a little insight into how comprehensive our medicine preparation program is there from Sephora. But if you do have any questions, please do post them now. There have been a couple of questions that have been put through sort of last minute, so I will sort of put those as well. But now is your chance to ask any questions via the chat and the Q&A, and we'll try to get to those as quick as possible. I thought just while we're waiting, I'd just do a quick sum up of the poll. Thank you for everyone who is taking part. I think pretty much everyone did at various points, so that was great. We'll just test your learning, see if it kind of sunk in and you've got the correct answers. So I'll give it, I won't, obviously there's no individuals in here, but for the first question, which was, which professions is the medicine preparation program designed for? 82% of people went for C, which was medicine, dentistry, and veterinary medicine, which Sephora can tell us if that's correct.
It is correct. It's yeah, absolutely. 82% of people hit the right option there. Excellent. I noticed some people hit the option that had pharmacy in there. I can understand why people might find that a little bit confusing. Pharmacies is not part of the medicine preparation program. We would support pharmacists via the pre-degree diploma. So just to reiterate, the medicine preparation program is specifically for students that are applying to become a type of doctor rather than a pharmacist. Okay?
Thank you, Sephora. Interestingly, actually, we did have one of the questions that came through quite late was about nursing, and I know you touched on the. Obviously, this is not a program for nursing, but for a nursing student interested in going into nursing, I presume they would be kind of similar backgrounds in terms of the subjects they were taking, or is it much broader in terms of what you can take?
Well, it would be similar background. The requirements aren't as tough for nursing, and they wouldn't need to take the UCAT. So it would be, biology and chemistry would be really ideal for that. And students tend to take maths as well, but the grade requirements are a little bit more varied and they are lower. But again, we would support students through the pre-degree diploma for that. But, as I say, everyone at Abbey is supported.
Yeah, so very, very possible for those subjects, but just not through this particular program within the college.
Because actually nursing is a really nice way to work with patients and care for patients without the same pressure as actually applying for medical school, because just you don't have to prepare as much, and ideally you don't have to take the UCAT. So that's a good alternative career.
Excellent. So for the second one, which of the following must you have in order to make a successful medical school application? We had 89% say answer C, which was excellent A levels and GCSE or home country given was at least 6 or 7 subjects. So I think that's correct, right? I think that's kind of the right answer.
Again, the majority are correct. Can I just address some of the incorrect answers? Because I noticed that some students or some participants rather picked the other option that said GCSEs in 2 subjects. This can cause confusion. I can understand why students have picked that, because sometimes the university websites will say, well, students only really need a minimum of maths and English. They only mention those 2 GCSE subjects. But actually, if you only had studied 2 GCSEs, it's highly unlikely you will be invited to interview, because they're only inviting the top students to medical school interviews. So the more GCSEs you have, the more competitive the application.
Great, excellent. And then with question 3, which following non-academic prerequisites do you need for successful medical school applications? We had 82% go for answer A, which was UCAT, medicine and dentistry, and 6 months of volunteering work and some clinical shadowing. 12% went for B, which is UCAT, medicine, dentistry only, and we had 6% go for the UCAT and 6 months of volunteer work and clinical shadowing in the UK only.
Yeah, again, everybody was right. It was the first option. The first option was different to the third option, because the first option said that clinical shadowing and volunteer work in home country or UK is appropriate. So it doesn't have to be UK only. It can be home country as well.
Perfect. And then for question 4, what types of medical application can international students make? Again, 82% went for answer C, which said can apply to medical schools both through the UCAS and through the direct application routes. We had 12% go for only to 4 medical schools through UCAS, and then 6% went to only medical schools which accept direct applications outside of UCAS.
So it sounds like the majority got the answer right for that one. Again.
Excellent. And the final question, which was a bit of a cheat question from our point of view, were how does Abbey College Cambridge help a student prepare for their medical application? Well done to the 93% who said all of the above. We did have 7% just saying UCAT, but obviously we help students with UCAT, with volunteering work, with clinical shadowing placements, and for developing their interview skills, and for learning about medical science beyond the curriculum. So the preparation program is designed to help.
We do it all. Yeah. Not just UCAT only. Don't worry, we'll look after you. We'll help you with everything. Yeah, all of the above.
Yeah, we've got the plan. We had a couple of quick questions just come through the Q&A. I'll just sort of put those to you as well. One just said, is there any age limit? I don't know if they're talking about specifically for the A-level program or obviously for progression into medicine. So I don't know if that's something we can address on those 2 areas.
Oh, that's a very, very, very broad question, because age limit for what? If you could, any age limit for to start year 12?
Yeah, I think from the point of view of our program, obviously, I think we accept students generally for our A-level programs for 16 up to about 19 years. We can make some exceptions, but I think in terms of medicine, kind of that's kind of the normal age limit. And then obviously, I think for medical schools, tell me if I'm wrong, but do they need to be 18 to kind of then move on to medical schools? So you could potentially
Absolutely.
start a bit younger in your A-levels, but the problem is you have to be 18 or an adult in the UK to go on to medical school.
Absolutely. It does vary from medical school to medical school, but generally, for many medical schools, by the time you start the course, you have to turn 18. Or if you're 17, you have to turn 18 at some point close to the start of the course. So sometimes we do have students that start year 12 a year early, and we actually have to ask them to take a gap year because they'll be too young to make the application for medical school after year 13. So generally, it's best if you want to apply to medical school directly after university, you should really be turning 16 in year 12. So you should be very close to 16 at the start of year 12.
Yeah. And it's obviously a very intense program that they're going into as well. Is there any upper limit in terms of application to medical schools? Obviously, we accept
you can be. What you mean? How old? What's the maximum age?
Yeah.
No.
Yeah.
No,
I mean,
no.
that was my understanding. I just thought I better check just on the side of the
Yeah.
question. Is very broad. I think one thing to be aware of, obviously, the medical program is a long-term program in terms of the study as well. So I think, tell me if I'm wrong, Sephora, but I think you're talking probably 6 to 10 years in terms of from the point of view of entering medical school to actually qualifying as a consultant or a fully qualified doctor.
Absolutely. Well, yes, absolutely. So the undergraduate course is a minimum of 5 years. Some institutions offer the 6-year course as well. That's just to qualify as a doctor. And then after that, you've got to do 2 years called the foundation years, which are training in hospitals. So that's now taken it up to 7 years. And then if you want to become a specialist, it depends on what you might want to specialize in, but it could be a further 8 years of training. So top surgeons and things like that might end up spending 15 years of training to finally reach their ultimate profession. Just noticed a good question there. How long will students do their clinical shadowing? It varies. There isn't a specified minimum for that because you get what you get, basically. So some students perhaps can only get a minimum of 1 day of clinical shadowing. The importance is that you can talk about what you learned from that clinical shadowing. Obviously, our hospitals have thousands of applications, so they're only able to offer our student 1 day clinical shadowing. And sometimes that's all students can get. And if you can get that, that's great. Just make sure you do lots of learning from that, which is why I always encourage students to do some clinical shadowing in their home countries, because it can be a little bit easier.
Excellent. Thank you, Sephora. I think that kind of covers everything that's been asked. We will send you guys obviously the recording from today, but also because there was a lot of links in the presentation, we'll get the presentation as well and send that together so you guys can kind of explore some of those links. And if you do have any questions, obviously, if they pop into your head, if you're joining us in September or you're thinking about joining us in September and you want a bit more clarification on any area, we'd be very happy to do that. So do drop us, do respond via email, and we'll do our best to answer that. But I think kind of that's it for today. Thank you, Sephora, for your time, and I'll let you sign off and we'll head off.
It's an absolute pleasure, and I look forward to meeting all of you in September. Have a good summer, everybody.
Thank you, everyone. Bye-bye.
Thank you. Bye-bye.